Over the years, MS Teamworks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
I'm Brian Walker, physician assistant with the Department of Neurology at Duke University. Overall wellness is important to patients with multiple sclerosis, just like with any chronic disorder. We want to make sure that we're addressing all types of issues. Wellness can mean lots of different things to lots of different people. We want to concentrate on physical wellness, nutritional and dietary issues, as well as mindfulness and emotional wellness. Like with any other long-term medical conditions, overall wellness is important not only in the short term, but in the long term. If we think about it as, say, getting your car prepared for a long-distance trip, you want to make sure that your gas tank is full, that your tires are properly inflated, and that your oil is good. So in the same sense, we want to make sure that you're taking care of both physically and emotionally for the long journey ahead. This is not a sprint, but a marathon. So just like a long-distance car trip, we want to make sure that you're going to run out of gas along the way. You're going to hit a pothole from time to time. But as long as you have that physical and mental reserve, that'll better prepare you for the long journey. Important lifestyle changes for persons living with MS to consider would be things such as physical wellness, emotional wellness. We think of things such as smoking cessation, which has been shown and proven to improve outcomes long-term with MS. Physical wellness is incredibly important and has been shown in multiple studies to be very effective in all long-term outcomes. Sometimes as important as the disease-modifying therapies or treatments that patients take. It's important to realize that any activity is better than no activity. It's also important to remember that it's good to check in with a physical therapist or a trainer who specializes in neurological disorders to work with a patient's specific physical abilities so that they can maintain physical wellness and excellent exercise health habits. Physical exercise doesn't necessarily mean training for a marathon or a triathlon. It can be doing housework. That's actually been shown to be very helpful for patients. If folks have different physical abilities, there are different exercise programs that can be done. There are online modules that can be done with a patient at home, same time or maybe at a different time than the class that's going on. There are patients who lead these exercise programs from gyms and their own homes that can accommodate for a patient's physical abilities. Diet and nutrition is important for everybody, regardless if you have MS or not, but certainly with patients living with MS. So what we want to consider is that we're having overall good nutrition. The old adage rings true. If it sounds too good to be true, it probably is. As many diets as there are out there, we have to keep in mind that none have been specifically been proven to help MS specifically. We tend to think with basics. Stick with what we know. Mediterranean type of diets, which are heavy in fruits and vegetables, lean proteins, and hydration, are very important. Avoiding things such as excessive alcohol, excessive caffeine, processed foods, refined foods, sugars, carbohydrates, these are all things that can lead to problems. Going back to hydration, hydration is also very important. We want to make sure that patients are well hydrated by increasing their water intake as best as possible. But we also know that patients with MS have urinary dysfunction that can make them not want to drink water, which is a fine balance. But it's going to be important to know that dehydration can cause more problems than not. So it's important to talk to your healthcare provider about those. In today's health-conscious world, there are a lot of nutritional supplements that are out there. Some of those nutritional supplements have been studied specifically for MS. The role of vitamin D, biotin, and probiotics have been studied in MS. We know that some of these things can be helpful. So the issue is how much to take and when to take them. For things such as vitamin D, we can actually run laboratory tests to find out what your vitamin D level is and make recommendations on how much vitamin D to take. One of the things to remember is that with any of these nutritional supplements, there's no FDA regulation to substantiate claims that are made with regard to efficacy. One thing to remember, just like with any other vitamin or supplement that's being taken, as long as you look for a lot number and expiration date on the side of the packaging, that ensures that the company that manufactures that product has a quality control process in place, meaning that it's generally safe. It's important for patients to let their providers know about any nutritional supplements that they're taking. Sometimes nutritional supplements can actually interact with certain medications that patients are taking, not necessarily the disease-modifying therapies that they're on, but maybe interact with any other medications they're taking for symptom management. Sometimes wellness is a new concept to patients and they don't know where to begin. Oftentimes it's difficult for us to suggest specific resources for patients to go to. Most of the time, we recommend that patients go to the National MS Society website to obtain reliable sources of information with regard to wellness overall and use that as a starting point. We generally tell people to stay off of blogs. Emotional wellness is very important for patients living with MS, just as physical wellness and nutritional wellness as well. It's really one of the three parts that are important for overall wellness for patients living with MS. When we think about emotional wellness, a lot of times we think about mindfulness training or meditation, which can certainly be helpful and has actually been proven to help with things such as pain or muscle spasticity. Cognitive behavioral therapy can be helpful for patients with adjustment disorders or interpersonal communication or interpersonal problems. Couples counseling, family counseling can also be very helpful to not only the patients living with MS, but their caregivers as well and their care team. Spirituality from religious beliefs can oftentimes provide comfort and stability in times of uncertainty. What's important to remember is that this is a marathon, not a sprint. And just like training for a marathon, that includes physical wellness and preparedness, mental wellness and preparedness, nutritional wellness and preparedness, and that just like running a marathon, you're not running alone. Knowing that you're not alone in this, use your resources. Use the people around you to continue to motivate you. There are always going to be times where we're not going to feel like working out or eating right, or maybe we fall off the bandwagon and we start eating things that we shouldn't eat. Use your resources. Use the people around you to help keep you on track. Connecting with other patients that are also living with MS could be helpful to cheer you on, to keep you motivated, to keep you accountable for doing these things. Working with other team members within your own home so that you're all on the same page with things like nutrition and exercise and rest will always be helpful for you to remember that you're not alone in this and using those resources along the way. Many times patients living with MS are used to taking care of others and not themselves. It's important to realize that you're not being selfish. You need to take that time for yourself in order for you to be well. That means making sure that you have adequate time to take care of yourself by continuing your physical exercise, by maintaining your nutrition, by maintaining your sleep, and by maintaining your emotional wellness.